Good to go, Drew? Good afternoon all. Well, the Wellcamp saga will forever be remembered by Queenslanders as what happens when a government prioritises politics over people. And throughout this, from the get-go, we have called it for what it is. And that was a decision by a state government looking to play pandemic politics with a political opponent in Canberra. And when that happens, no one wins. We have fought for months to have the true cost revealed. And we were told repeatedly that it couldn't because of commercial in confidence reasons. Well, that all disappeared when a brave acting Auditor-General called it for what it was. There was never a reason to keep this commercial in confidence. There was no public tender, and therefore that excuse never cut it. And to see the way that the government has sought to backtrack on that and say that they always wanted to share this with Queenslanders is disappointing. To see the Deputy Premier today double down and, rather than say sorry to Queenslanders for the waste, to attempt to rewrite history and to attempt to say that this was not really about future-proofing after all, that it was a 1-in-100-year event and therefore they made the right decision. To attempt to try and say that 700 people at a cost north of $200 million is a good deal for taxpayers is bitterly disappointing. Make no mistake, this is waste in the highest degree. This money could have put on 2,500 new nurses, 950 ambulance vehicles, 130 intensive care beds in the middle of the Queensland health crisis. Instead, Queenslanders got waste camp. And the government has no one to blame but itself. Everyone called this out as a bad deal from the get-go. Queenslanders needed a quarantine plan, but a leased facility in Toowoomba was never going to be that plan. On the topic of waste, I'm joined by the Shadow Minister for Small Business, Brent Mickelberg, who will make a startling revelation that will come up in estimates this afternoon about further waste and a lack of attention to detail. Over to you, Brent.
Thank you, David. Afternoon all. Well, you've just heard about the waste in Wellcamp, and the latest example of waste from this state government is $2 million for 2 tradies. $2 million wasted on the Tradies in Paradise program, which has delivered 2 tradies for Queensland. Those 2 tradies have been paid $3,500, and the rest of the about $1.96 million has been spent on advertising. Advertising a failed program that has not delivered for Queenslanders. Queenslanders who have been flood affected and flood ravaged right across the southeast and across Queensland, who need more from this state government than good publicity and an advertising program. They deserve better than they've got, and they certainly deserve better than throwing good money after bad. We just heard from the Deputy Premier who suggested they might throw more money after this failed program, and I'll certainly be asking questions of the Minister in estimates this afternoon. That would be a travesty for all Queenslanders. 2 tradies for just a shade under $2 million does not pass muster for Queenslanders, and we need to see better from this state government. Consistently, we've seen this state government waste money on programs that are ill-conceived and ill-delivered. They fail to plan, and they care more about what things look like than what things really are. Queenslanders deserve better. Think what that $2 million worth of government expenditure could have got had they spent it on new carpets or electricians replacing wiring in flooded homes. It is simply not good enough that the state government continue to fail and continue to just wastefully spend Queenslanders' money. Queenslanders' taxpayers' hard-earned funds that is wasted on ill-conceived and ill-delivered programs. We see it time and time again. It's simply not good enough.
Brent, just wait there. The state government said that it's tough to get labour, in all markets. What could they have done differently? Shouldn't they be commended for having a go to get tradies here?
Well, I guess the question needs to be asked why they thought it was appropriate to spend $1.96 million off the top of my head on advertising when the incentive was $1,750 to get a tradie to come up here. Tradies have told me that a tradie in Victoria, for example, which was one of the markets they targeted to try to attract people, get paid about $15 an hour more than they do in Queensland. So were that tradie to come up to Queensland and work for another 3 weeks, they would have earned more staying in Victoria than they would have got from the incentive. And that doesn't even take into account the relocation costs, trying to come up to Queensland, hauling their tools up here. It was an ill-conceived idea from the start. It was a thought bubble that was designed to get attention and publicity rather than deliver for Queenslanders. The Minister needs to answer questions about what plans they put in place when they were considering implementing this program. Why did they think it was going to work? Why did they think $1,750 was going to attract a tradie to Queensland? On the face of it, it doesn't pass muster, and the delivery of that program has certainly borne out that it was a failed idea in the first place. And unfortunately, it's not the first time we've seen it. We've seen it time and time again. In my portfolio, every single grants program that the government have rolled out have had consistent issues. They repeat the same mistake time and time again, and Queenslanders deserve better.
So are you saying the incentive should have been more?
Well, what I'm saying is that they need to ensure that when they're structuring these programs, it's about the substance of the program, not about the publicity. It doesn't make sense to me that you would spend $1,750 trying to attract a tradie and $1.96 million on the promotion of that program. The balance is not right there. If the program was structured appropriately to try to attract a tradie to Queensland, and we know the costs associated with relocating to Queensland from somewhere like Victoria, and we know the competitive pressures that exist right across Australia in relation to the skills market, we need to do better. We need to structure it more appropriately.
How do you attract 1,000 tradies if you don't advertise?
Well, that's a question for the government. My point would be, why did the government think this was going to work in the first place? It was clear from the outset that $1,750 was not going to attract a tradie to Queensland. It wouldn't attract me to come to Queensland if I was a tradie in Victoria, earning $15 an hour more, setting aside all of the associated inconvenience with upping your family and moving to Queensland, and they've got to work here for at least 2 weeks. So, fair enough, these programs need to be publicised, but the reality is it needs to be about the substance of the program. It's great that they spent money advertising the program, but the concept was ill-conceived from the start, and we can see in the result that it was ill-conceived because they've only delivered 2 tradies, both of which have got a combined $3,500 from the government, and the advertising cost for this is just a shade under $2 million. It just doesn't pass muster.
But isn't that 2 tradies so far? Isn't the scheme open until November, and there could be a lag with people actually being paid out as they meet the eligibility criteria?
There could be a lag, but let's bear in mind that they've spent $1.96 million already, and they've only had 12 apply, 2 of which have been paid for. So, best case, we're talking a shade under 30 grand that might have been paid out for a program that would have delivered, had all of those who have applied actually delivered 2 weeks' work, who would have delivered a very limited capability for Queensland. That money would be better spent actually providing services to people who have been flood affected in areas like Ipswich, in parts of Brisbane where people are crying out for support from the state government, more support, and this money's just been wasted on an advertising program which is a thought bubble.
Do you want the whole program scrapped now?
Well, it's certainly been a failure. I'd like the Minister to explain what she's going to do to either rectify the program. I certainly don't want to see the government spending more money on an advertising program to prop up a failed adventure that isn't delivering for Queenslanders.
Thank you. On Wellcamp, what would you have done facing an ongoing pandemic, jam-packed hotel quarantine system? What would you have done in that position?
First of all, I would have been honest with Queenslanders, and from the get-go, the government wasn't. And when the Premier stood up in February and said that Wellcamp was open, she distinctly said that hotel quarantine was over. It wasn't. And whilst we continue to talk about $237 million in waste at Wellcamp, there's an additional $40 million since the opening of it to have hotel rooms that had a dozen people in it. So that's the first part. The second is I would have worked with other levels of government to actually, rather than do a political get square, to come up with a solution. Now, at the time, there was a very clear view from everyone other than the Premier and Dr Miles that this wasn't going to work. So I don't cop the argument from the Deputy Premier that somehow this is about rewriting history. Across the board, people were telling them this wasn't the right answer. And that wasn't just people in the political field. The AMBOs were saying what a ridiculous notion it was because they were going to lose many hours going backward and forth and having to clean going back to the capital city. The people at Toowoomba Hospital were saying if there was an outbreak and it needed to be served there, they just did not have the capacity to deal with it. The Mayor of the city didn't know about it. On the day of the announcement, both the Prime Minister and the Mayor of the city didn't know about it. And when they were asked, when the Premier was asked why, she said, well, they do know now. Doesn't that show you everything you need to know? This was always about a political get square. And in the end, the losers have been Queensland taxpayers. And that's what happens when governments prioritise politics over people.
The ALP and the Wagners say that this federal government hadn't been didn't go on a walk slow, then a solution could have been come up with earlier. Do you think it could have been even a better deal for Queensland if they had built it earlier?
I saw those comments from the Deputy Premier, and I'll just make a point. If you go back and look at when announcements were made and around key timelines, I think it'll tell you everything you need to know. From the get-go, the state government saw this as a political opportunity. And unfortunately, as a result, Queenslanders are collateral damage. There's a lot of money. We're not talking about a little Mickey Mouse amount. This is an amount of money that could have gone a long way to healing the Queensland health crisis. And right now, more than ever, Queenslanders look at the waste and they say, imagine what that money could have done to the health system. Because the level of apprehension is because Queenslanders have heard repeatedly the state of the Queensland health system. And Queensland Health was in crisis long before COVID, long before this dodgy deal was signed, long before. The numbers of Queensland Health were on the slide. And for the government to say that this was anything other than a $230+ million waste is attempting to rewrite history that Queenslanders won't allow them to walk away from.
Reagan said the deal was signed off by third parties and it presented a good deal with the benefit of hindsight, maybe not so, but it was a good deal at the time. And I would say that maybe you should stop criticising and focus on being more positive and not being so negative.
I don't begrudge the Wagners, not one iota. They've met a commercial deal that someone paid them for an asset that they now own, and they paid them handsomely for it. The person I have my beef with is Dr. Miles, who can't plan and doesn't value taxpayers' money. Pretty plain and simple. The Wagners have been given a couple of $100 million for an asset that only 700 people used, and it's now their asset. Of course that's something that they put forward and the government signed off on. Of course they should be pleased with that. But in the end, the custodian of taxpayers' dollars are not the Wagner family, it's the government of the day. And this government of the day can't plan, can't deliver, doesn't listen, and doesn't respect people's money. And from the get-go, there were many people saying that this wouldn't work. And I was just one of them. There were people in the medical field, there were locals in Toowoomba, there were doctors. And the government didn't listen. And if it had listened and in a sober and judicious way come up with a plan, Queenslanders would have backed them. But this was never about a plan for health. It was about a plan for a federal election. And as a result, Queensland taxpayers have a missed opportunity of a whole heap of money that could have gone to heal the health crisis.
What would your plan have been? Pinkenbar still isn't completed.
I would have worked with the federal government. I would have worked with local authorities. I would have listened to medical professionals. And let's call it for what it was. Hotel quarantine was still continuing. And the government had contracts in place for a long time with that. So there's no doubt that there needed to be a quarantine plan. But a leased facility in Toowoomba at a time when people were lining up to say that this was a dud deal was never going to be it.
I have a question on COVID and the impact on hospitals. How long do you think elective surgeries can keep being delayed? There's obviously so much pressure on the hospitals at the moment, but in terms of the impact on elective surgeries, what do you make of that?
Queensland's elective surgery waiting list had blown out to unprecedented levels before COVID. What COVID is doing is testing that even further. And the complication is when elective surgeries continue to get pushed back, there are consequences, and they can be fatal consequences. These aren't surgeries that don't count for things. They're things like cataracts and they're colonoscopies. They're important treatments that Queenslanders need. And my concern is that the government had 2.5 years to prepare for this. And Queensland Health was in crisis long before COVID. And doctors and nurses were putting forward a plan and the government didn't listen. And now, in Queenslanders' hour of need, that's when they need a world-class hospital. So the two things Queenslanders want to know. The first is, why, despite asking for time to get the health system ready, did the government not listen and not act? But more importantly, what is the government going to do now to give people the comfort that the Queensland health crisis can be healed? Because now more than ever, Queenslanders need a world-class health system, and the doctors and nurses are screaming for the government to listen to do something about it.
Can I ask about estimates this morning? When the government in the election campaign promises 6,000 teachers, do voters assume that means extra teachers or replacement new teachers?
The Minister knew what she said at the time, and Queenslanders knew what they heard. And for the Minister to try to rewrite history when there has been a failure to deliver those teachers is deeply disappointing. Good governments are honest, they listen, and they're on it, and they genuinely report on their progress. And this was a commitment at the election to deliver new teachers, and to attempt to rewrite history is deeply disappointing when every parent needs to know that there are enough teachers to look after their kids.
So what do you think the voters' expectation is when they promise new teachers?
The expectation was clear. They were new numbers, and the figures show that they haven't been delivered. And rather than try to rewrite history, the Minister should get back to work and deliver what every parent deserves, and that is world-class facilities and enough teachers to implement them.
I have another question, one more on health. On the Gold Coast specifically, nurses there are saying they're really struggling in the hospitals. What are you hearing about the Gold Coast and how concerning is it?
The Gold Coast is the most under pressure ED in the country, and the stories we are hearing are about staff at breaking point. Nurses working an entire shift without taking a break, barely being able to go to the bathroom. It is in crisis, and the Gold Coast Hospital is in an area where there is a population explosion. And there's a couple of things that need to occur. One is that hospital needs to be better resourced, and the doctors and nurses need to be put back in charge. But we also have to deliver a new hospital in the growing part of the Northern Gold Coast. And the budget papers reflect how far into the future that project is. Of the government's record health spend, less than 1% will be spent in the next 12 months, and barely half is even in the forwards. There is a health crisis at the moment, and the Gold Coast needs a new hospital in the northern area, wedged between an exploding ED in Logan and the Gold Coast, staff buckling under pressure, and a government that, after destroying the health system for 7 years, wants another 7 before they even build a new hospital. Thanks very much. See you guys. Thank you.